I often meet people who tell me, Doctor, I felt completely fine. I never imagined something serious could be developing inside my body. And that is perhaps one of the most unsettling realities about many forms of cancer. There can remain silent for a very long time. The purpose of this conversation is not to create fear. It is not to make you panic every time you notice a small change in your body. It is about awareness. It is about understanding the signals our bodies may give us and knowing when it is worth having a discussion with your doctor. One of the reasons cancer can be so challenging is that symptoms often appear late. By the time certain cancers begin causing noticeable problems, the disease may already be more advanced. Unfortunately, later diagnoses are often associated with lower chances of successful treatment and recovery. Research consistently shows that early detection matters. The earlier many cancers are identified, the better the chances of survival and, in many cases, complete recovery. Every year, more than half a million people in Germany receive a new cancer diagnosis. As people live longer lives, which is in many ways a wonderful achievement of modern medicine, the number of cancer cases within the population also continues to rise. Naturally, many of us worry about developing cancer someday. To be honest, after many years in clinical practice, this remains one of the health concerns that people ask me about most frequently. Current estimates suggest that nearly 1 in 2 men and roughly 3 out of 5 women will receive a cancer diagnosis at some point during their lifetime. Cancer concerns all of us. It can affect any family, any household, any age group. That is precisely why awareness is so important. Regular screening examinations remain one of the most valuable tools we have. I encourage you to discuss appropriate screening tests with your family doctor. Many people are surprised to discover that preventive examinations available to them are more extensive than they realized. But screening alone is not enough. It is also important to recognize changes that may appear before a scheduled appointment. The difficulty is that the earliest signs are often vague, they do not necessarily stand out. Many people dismiss them because they seem unrelated, harmless, or simply part of everyday life. I want to help you avoid making that mistake. What we are going to discuss are common warning signs that can occur in different forms of cancer, and I want to emphasize something very clearly. These symptoms can indicate cancer, but they do not have to. In many situations, there are much more harmless explanations. It is often the overall picture, several symptoms occurring together, or symptoms that persist over time that deserves attention. So please do not listen to this with fear. Listen with awareness. If you recognize something familiar, use it as an opportunity to have a conversation with your doctor. There is nothing better than receiving reassurance that everything is fine. At the same time, there is tremendous value in identifying a problem early, while more treatment options are available. Over the years, I have seen another pattern repeatedly. Many patients avoid seeking medical advice because they are afraid of what they might hear. But avoidance does not protect us. If something serious is present, pretending it does not exist rarely improves the outcome. On the contrary, delaying evaluation often allows disease to progress quietly in the background. Cancer itself is not a single disease. There are countless types, each behaving differently. At its core, cancer involves abnormal cell growth occurring where it should not. Different tissues in the body can be affected. This is why symptoms vary so greatly. Among the most common cancers are breast cancer, colorectal cancer, and lung cancer, just to name a few. Some risk factors can be influenced. Smoking, for example, plays a major role in the development of certain cancers, particularly lung cancer. Other factors are less controllable. Sometimes people do everything right and still receive a diagnosis. That reality can be difficult to accept, but it is important to acknowledge. Because different cancers affect different organs, they naturally produce different symptoms. However, there are also general warning signs that can appear across multiple cancer types. These general symptoms are often the first clues that something in the body deserves a closer look. Even if cancer is not the cause, another health issue may require attention. One of the most important general warning signs is unintentional weight loss. By this, we mean losing more than 10% of your body weight within 6 months without trying to lose weight. You have not changed your diet. You have not increased your exercise routine. Yet the numbers on the scale continue to drop. That deserves medical evaluation. Another warning sign is persistent fever or repeatedly elevated body temperature without an obvious explanation. A third symptom is pronounced night sweats, not simply feeling warm at night, not mild perspiration, but sweating so heavily that you need to change your shirt, replace your sleepwear, or even change your bed sheets. These three symptoms together are sometimes referred to as B symptoms. In clinical practice, they often prompt us to investigate further. Some people also describe profound fatigue, an exhaustion that feels disproportionate, a level of tiredness that cannot easily be explained by lack of sleep, stress, or physical activity. Others notice generalized body aches or discomfort without a clear cause. If you have experienced changes like these recently, I encourage you to take them seriously. Caution is often wiser than regret. A thorough medical evaluation can provide answers, and very often, the explanation turns out to be something much simpler: nutritional deficiencies, hormonal imbalances, an infection that has not fully resolved. Many conditions can produce similar symptoms. There is another important point I would like you to understand. Cancer itself is frequently painless. Because these abnormal cells often grow gradually within the body's own tissues, there may be no inflammation or obvious injury to trigger pain in the early stages. This invisible phase is one reason awareness matters so much. As tumors enlarge, however, they can begin occupying space and pressing against nearby structures. They may compress nerves. They may affect surrounding tissues. Only then does pain sometimes develop. Unfortunately, by the time pain becomes the reason someone seeks medical attention, the disease may already be more advanced. That is why subtle symptoms should never be ignored simply because they seem minor. Small changes can sometimes tell us important stories about what is happening beneath the surface. One of the most common signs that causes concern involves the lymph nodes. Many of us have experienced those small lumps that appear in the neck during a cold or throat infection. They can be tender to the touch and often become noticeable when the immune system is actively responding to an infection. Lymph nodes are an important part of our body's defense system. They act as filtering stations, helping the immune system recognize and respond to potential threats. In many cases, enlarged lymph nodes are completely harmless and temporary. After a viral infection or common cold is resolved, these swollen nodes often gradually return to their normal size. In fact, some people have enlarged lymph nodes that remain unchanged for many years. I understand how unsettling this can feel. Even healthcare professionals occasionally investigate these findings for reassurance. However, lymph nodes can sometimes enlarge for other reasons. Cancer affecting nearby tissues may spread to lymph nodes. In some situations, the lymph nodes themselves can be directly involved, as occurs in certain cancers of the lymphatic system. Many people do not realize that lymph nodes are found throughout the body, not just in the neck. They are also present in the armpits, groin, chest, abdomen, and many other regions. For example, breast cancer may spread to lymph nodes located in the armpit. Certain prostate cancers can involve lymph nodes in the groin region. The lymphatic system extends throughout the body, which is why changes in these structures deserve attention. Lymphomas, cancers that originate within the lymphatic system itself, often present as painless swelling of lymph nodes. The key word here is painless. Painful lymph nodes are often associated with infections, although this is not always the case. Painless enlargement that persists requires careful assessment. So, when should you seek medical advice? First, if swollen lymph nodes appear during an infection but do not disappear within 3 to 4 weeks after the infection has resolved. Second, if you notice enlarged lymph nodes without having experienced any recent illness at all. Third, if the swelling is particularly large, increasing in size, or measures more than approximately 2 centimeters. And fourth, if enlarged lymph nodes occur together with the general symptoms we discussed earlier, such as unexplained weight loss, persistent fever, severe night sweats, or marked fatigue. When patients describe these symptoms, physicians often ask detailed questions about exactly these accompanying signs. Please remember that swollen lymph nodes do not automatically mean cancer. Far from it. Most enlarged lymph nodes are caused by infections and other benign conditions, but persistent changes should always be evaluated rather than ignored. The next warning sign involves changes affecting the skin. When people think about skin cancer, they often picture dark spots or moles that change in appearance. That association is understandable, and paying attention to changing moles is indeed very important. Regular skin examinations can save lives. I strongly encourage people to participate in recommended skin cancer screenings. Even those of us working in medicine understand the value of having suspicious areas evaluated by specialists. But changes in the skin extend beyond moles. There are several additional findings worth noticing. One example is the development of palpable lumps or hardened areas on or beneath the skin. These may feel different from the surrounding tissue. They may persist rather than disappear. Another important sign is wounds that heal poorly. Our skin has an extraordinary ability to repair itself. Cuts and minor injuries generally improve with time. When an area repeatedly fails to heal, continues to break down, or remains unchanged over long periods, it deserves medical attention. Changes in skin color can also be significant. For example, unusual paleness may occasionally reflect a reduced number of red blood cells. Certain blood cancers, such as leukemia, can contribute to this finding. However, it is essential to keep perspective. Many other conditions cause anemia. Iron deficiency remains one of the most common explanations worldwide. This illustrates an important principle. A symptom rarely belongs to only one disease. Medicine often requires looking at patterns rather than isolated observations. Now let us talk about the digestive system. Almost everyone has experienced temporary stomach discomfort, a few days of nausea, occasional abdominal pain, a brief change in bowel habits. These experiences are common and usually harmless. The concern arises when these changes persist for weeks or continue to worsen over time. Perhaps your bowel habits have changed without explanation. Maybe constipation alternates with diarrhea. You notice a consistent alteration in stool consistency. The color of the stool changes. You develop ongoing abdominal pressure or a sensation of fullness that does not resolve. Blood in the stool deserves particular attention. Hemorrhoids are a common and often harmless cause of rectal bleeding, but they are not the only cause. Blood in the stool should never simply be dismissed without discussion with a healthcare professional. Repeated vomiting can also be concerning. When digestive symptoms persist and are accompanied by other warning signs, further evaluation may be necessary. These symptoms can sometimes be associated with cancers affecting the digestive tract, including colorectal cancer, stomach cancer, or pancreatic cancer. The digestive system is remarkably resilient. Often it compensates quietly while changes develop beneath the surface. That silent phase is another reason why persistent symptoms matter. The body frequently whispers before it shouts. Listening early gives us opportunities to intervene. Another area deserving attention involves the airways and upper digestive tract. Have you developed a cough that simply refuses to go away? Has a long standing cough changed in character? Does it sound different? Has it become more severe? One symptom that should always be taken seriously is coughing up blood. Even a small amount warrants prompt medical evaluation. Persistent coughing with blood can sometimes indicate lung cancer. Lung cancer remains one of the more common cancers worldwide. Other symptoms involving the lungs, mouth, or throat may also occur. Chronic hoarseness, difficulty swallowing, shortness of breath. These changes can have many explanations. People who have had stable hoarseness for years may not necessarily be experiencing a newly developed cancer. Context matters, duration matters, change matters. The question is not simply whether a symptom exists. The more important question is whether something has changed from your normal pattern. Has it persisted? Has it progressed? Has it appeared alongside other concerning signs? These are exactly the details physicians explore during consultations. Sometimes the answer is reassuring. Sometimes further testing is appropriate. Either way, seeking advice provides clarity, and clarity is often far less frightening than uncertainty. There's one more group of symptoms that many people do not immediately associate with cancer, and that involves changes affecting the nervous system. Our brain and spinal cord coordinate nearly everything we do. They help us move, speak, maintain balance, process information, and interact with the world around us. Because of this, when something disrupts these systems, the symptoms can be wide ranging. Persistent dizziness, for example, can have many harmless explanations. Vision problems may be related to eye conditions, stress, migraines, or other common causes. However, neurological changes that are new, persistent, or progressive should never be ignored. Some people notice ongoing visual disturbances that do not resolve. Others develop weakness or numbness. Speech may become difficult. There may be unexplained problems with coordination. Some individuals experience seizures for the first time in their lives. These symptoms can occur for many different reasons, many of which are not related to cancer. However, they can occasionally be warning signs of tumors affecting the central nervous system. At the same time, there is another important point to understand. If neurological symptoms appear suddenly within seconds or minutes, particularly symptoms such as facial drooping, weakness on one side of the body, speech difficulties, or sudden vision loss, this may represent a stroke rather than cancer. A stroke is a medical emergency. Immediate action can save brain tissue and improve outcomes. Do not wait. Seek emergency medical assistance right away. Now let's turn our attention to warning signs involving the female reproductive organs. Many people are aware that breast cancer is one of the most common cancers affecting women. What surprises some patients is that it can also occur in younger women. This is one reason why awareness and regular examinations remain so important. Routine gynecological checkups form one of the strongest defenses we have in identifying abnormalities early. Many women already participate in these preventive visits, and that commitment to their health is incredibly valuable. Breast self awareness is equally important. You know your own body better than anyone else. Pay attention to changes. A lump or firm area within the breast deserves evaluation. You may also notice changes involving the nipple, including unusual retraction or pulling inward. Differences in breast size that newly develop can sometimes be significant. Changes affecting the skin overlying the breast should not be ignored. None of these findings automatically indicate cancer, but they should prompt a conversation with your doctor. With regard to the uterus and ovaries, there are additional symptoms worth recognizing. Unexpected vaginal bleeding outside of your normal menstrual cycle can be important, especially if it occurs repeatedly. For example, if bleeding begins appearing between periods without a clear explanation, it should be discussed with your gynecologist. Unusual vaginal discharge may also deserve attention, particularly if it becomes persistent, changes noticeably, or appears alongside pelvic discomfort. Some women describe pain that feels different from their usual menstrual symptoms. Perhaps it is more persistent. Perhaps it has a different character. When your body behaves differently from what is normal for you, it is worth seeking medical advice. The goal is never to create anxiety. The goal is to investigate appropriately and, whenever possible, provide reassurance or early intervention. Now, let us talk about warning signs involving the male reproductive organs. Among men, prostate cancer is one of the most frequently diagnosed cancers. Testicular cancer occurs less commonly overall, but there is an important detail many people do not realize. It affects younger men more often than many other cancers. In fact, among men between the ages of 15 and 45, testicular cancer is one of the more common tumor diagnoses. Because young adults generally do not expect serious illness, symptoms may be overlooked. Time passes, medical appointments are postponed. Unfortunately, valuable opportunities for early diagnosis can be lost. For this reason, awareness is especially important. Men should pay attention to enlarging lumps or areas of firmness within the testicles. A sensation of heaviness may develop. Some describe a dragging feeling. Others notice pressure or discomfort within the scrotum. These changes deserve medical evaluation. Just as women become familiar with the normal feel of their breasts, men should become familiar with the normal appearance and feel of their testicles. Knowing what is normal makes it easier to recognize when something changes. Prostate cancer often develops quietly in its early stages. Some men notice increasing difficulty with urination. The urinary stream may become weaker or interrupted. There may be an increased urge to urinate, particularly during the night. Blood may occasionally appear in the urine or semen. These symptoms should never be ignored. However, perspective remains essential. An enlarged prostate unrelated to cancer becomes extremely common as men grow older. Many men will experience benign prostate enlargement if they live long enough. The presence of urinary symptoms alone does not mean cancer is present. Again, patterns matter. Persistence matters. Medical evaluation provides answers. As we come to the end of this discussion, I would like to emphasize one final message. The symptoms we have talked about today can have many different explanations. There is no single symptom that belongs exclusively to cancer. Very often, there are much more harmless causes. But if symptoms persist over time, worsen, or interfere with your well being, it is wise to investigate them. Regardless of whether cancer is ultimately responsible, your body is telling you that something deserves attention. Please do not ignore that message. I also encourage you to learn about the preventive examinations available for your age group. Speak with your family doctor, ask your gynecologist, consult your dermatologist. Many people qualify for screening tests they may not even know exist. These examinations can reduce uncertainty and, in some cases, identify disease before symptoms ever appear. Whenever possible, prioritize prevention. Take advantage of recommended screenings. Do not allow fear to become a reason for avoidance. In my years of clinical practice, supported by what medical research continues to demonstrate, I have seen how powerful early action can be. Sometimes the result is reassurance and peace of mind. Sometimes it leads to treatment at a stage when outcomes are far more favorable. Both are worthwhile outcomes. Your health deserves attention. Your concerns deserve to be heard. And asking questions is never a sign of weakness. It is a sign that you are taking responsibility for your well being. If this video has been useful to you, please give it a like, subscribe to the channel, and turn on the notification bell. Help me reach 50,000 subscribers so that more people can receive this information.